Good afternoon, everyone. We apologize for the delay, but we'd like to thank everyone for attending this webinar, all of our grantees. We'd especially like to thank the CDC for providing this very informative webinar for us today. So before I begin, I just want to give a brief summary of what will be covered today, and then I will provide a bio of the speakers. Some of the objectives that you will learn today in this webinar is that you will become more familiar with the CDC's Division of Community Health, any potential grant opportunities that may be offered by this organization. You will also have a better understanding of tobacco-related health disparities as it relates to special populations, and you'll also have a better understanding of how health center programs can partner with public housing authorities or other organizations to implement tobacco cessation programs. And you'll also become more familiar with how to locate tobacco cessation tools, resources, and publications. Just to give you a little bit of a background on the speakers that we have Mr. Paul Hunting. And for the last 19 years, Paul has worked in various capacities within county, state, and national tobacco control and chronic disease programs, including the coordinator for tobacco control for a large rural county in California for over 3 years. As a project officer for the state of California, Tobacco Control Section for 8 years, and for 6 years as a project officer with the Centers for Disease Control and Prevention Office on Smoking and Health in Atlanta, Georgia. Paul joined the CDC's Division of Adult and Community Health in early 2000. Steve also plays a lead role in coordinating OSH's activities around cessation and quit lines. Steve has also worked with the OSH Health Communications Branch as a program consultant with the OSH Program Services Branch and as strategic coordinator of OSH's secondhand smoke activities. Before joining CDC, Steve spent 6 years as a regional field director with the New Mexico Tobacco Control Program. Steve is an author of a number of MMWR studies and other journal articles on the evolution and effects of smoke-free policies, news media coverage of tobacco control, and other topics. Steve is also an author of the 2006 Surgeon General's report on the health consequences of involuntary exposure to tobacco smoke and of the CDC Evaluation Toolkit for Smoke-Free Policies. Mr. Hunting and Mr. Babb, I'll now turn the presentation over to you.
Thank you very much, Jeanette. Good afternoon, everybody. As Jeanette said, my name is Paul Hunting, and I'm a Senior Project Officer with the Division of Community Health. It's a newly formed division within the Centers for Disease Control. And as she also mentioned, joining me in this presentation, and we'll be kind of tag teaming back and forth, is Mr. Steve Babb with the Office on Smoking and Health, or OSH. That's one of the things you'll come to realize in this presentation is that we love our acronyms. And so when Jeanette mentioned OSH, we might refer to that as OSH for the Office on Smoking and Health, which is one of our core programs within the National Center for Chronic Disease. We will be providing a very brief overview of our two divisions and our programs, as well as some of the accomplishments from the last few years and some of the future directions as they relate to smoke-free multi-unit housing and tobacco control work, which is core to both of our efforts. The commitment of CDC to state and community health is at many, many levels throughout the National Center for Chronic Disease. Both the Office on Smoking and Health and the Division of Community Health promote sustainable efforts to improve health and achieve health equity, working with communities, states, tribes, territories, and a variety of federal and non-governmental partners. The division is committed to strengthening community-level health efforts throughout the nation and helping communities prevent disease and promote healthy living. We place special emphasis on people experiencing the greatest burden of death, disability, and suffering from chronic diseases. The core principles of the division are on this slide. Maximize health impact, and we do that through addressing evidence-based tobacco control and obesity prevention strategies at the population level. We seek to achieve health equity, and if that's a term that you're unfamiliar with, health equity is basically a disproportionate burden of adverse health outcomes on one population that has a particular characteristic over another. It's not necessarily based on ethnicity. It might be based on issues such as poverty or low education or other aspects. So we look to see if we can how thinly we can cut the data such that we determine if there's one population that's being disproportionately impacted over another. And we use and expand the evidence base to create sustainable systems and environmental changes. Steve, do you want to address slide 4?
Sure, Paul. Thanks, and welcome everybody to the webinar today. So, so OSH, again, another acronym, is the CDC Office on Smoking and Health. OSH is the lead federal agency for comprehensive tobacco control in the federal government. So it just so happened that we're actually based down in Atlanta as part of CDC. But we are kind of the lead agency. And we have 4 specific goals which are laid out in this slide, which basically are: 1, to prevent initiation of tobacco use among youth and young adults; 2, to encourage people who already smoke or use tobacco products to quit and to help them quit; 3 is to protect non-smokers from secondhand smoke and its health effects by working towards eliminating smoking in public places, workplaces, and other areas through a combination of policy and education. And then 4th is identifying and eliminating tobacco-related disparities. So this could be populations that have high rates of tobacco use, or low rates of tobacco cessation, or limited access to cessation services, high levels of secondhand smoke exposure, and other types of disparities in terms of tobacco-related issues. And those 4 goals are also the guiding goals of our national tobacco control program, under which we provide funding to all 50 states and the District of Columbia, and then I'll talk more about our other grantees later. But so all of our grantees also work towards advancing those 4 goals through comprehensive approaches. And you can go to the next slide.
Thanks, Steve. In the Division of Community Health, we have multiple programs that focus on bringing, on bridging disparities and improving population health at the local level. Housed under the Division of Community Health, we've got REACH, which is one of our historical programs. REACH stands for Racial and Ethnic Approaches to Community Health, which has historically funded a number of initiatives such as the REACH US, which you may be familiar with, and REACH 2010. We also have the Healthy Communities program, which includes Pioneering Healthy Communities, and ACHIEVE, which stands for Action Communities for Health, Innovation, and Environmental Change, and then the Strategic Alliance for Health. We also have one of our more recent programs, Communities Putting Prevention to Work, and our most current program, Community Transformation Grants, which also includes our recently released Small Community Grants, which funds 40 communities across the country serving jurisdictions with less than 500,000 people each. The map on this slide shows the distribution of community health investments by programs funded through the Division of Community Health. The Office on Smoking and Health provides funding and technical assistance to state-level programs in all 50 states, Washington, D.C., Puerto Rico, U.S. Virgin Islands, Pacific Territories, and on a competitive basis to tribal and other national organizations, which Steve will touch on later. The Division of Community Health investments are also in all 50 states, as well as with tribal and national organizations around the country. The issue of health equity is central to the work of both DCH and OSH. The core of our work is based on policy systems and environmental change approaches that jurisdictions are implementing, which multi-unit housing policy falls right in line with that. When folks are trying to create smoke-free multi-unit housing complexes, buildings, units, and so forth on a system-wide basis, on a population-wide basis through cities, counties, and other jurisdictions. But these approaches are promising, and they're essential to addressing health inequities, whether those inequities are defined by ethnicity or socio-demographic characteristics, as I mentioned, such as low SES, which can frequently, but not always, be associated with those living in multi-unit housing environments. But theory and practice are hard to reconcile at times. Many states, communities, etc., get varying support from community leaders to adopt, implement, or adequately enforce policies that may not be entirely popular. There's differential enforcement issues with existing policies. Basically, there's more or less enforcement of the no smoking and smoke-free rules. And there's also site and program selection factors and implementation challenges that can be affected by budget challenges, delays in execution, etc. Essentially, folks that say we have bigger fish to fry at this point in time, so we're not going to worry about that. But these policies are not simply a policy in policy name only. These policies are designed because of the kind of folks that live in multi-unit housing, high percentages of children, etc. They're designed to protect public health. These barriers and negative unintended consequences could be related to implementation challenges or differential enforcement, and they may be accounted for and addressed in a approach that is designed with the community in mind. Getting a wide base of community support is important to making sure these programs are implemented effectively and are jurisdiction-wide. Well, why do we care about jurisdiction-wide or population-wide? Well, we know that state action paves the way for local innovation. So much of the work that's been done through programs funded by the Office on Smoking and Health, which has been in existence for much longer than the Division of Community Health, that state work can pave the way for local innovation. State work can establish a precedent, or it can take broad stroke approaches to prevention. Local action can be highly impactful, and local action frequently informs the next phase of state and national level policy. For example, if the state of California passes a smoke-free workplace law that has some exemptions in it, well, and local communities are not preempted, which means they can't take action on their own. If they're not preempted of adopting stronger policy, they can choose on their own to establish stronger policy that basically sets the stage for, okay, this is the minimum expectation. Local action can be highly targeted, and local action can strengthen linkages between local and state public health. And population-wide approaches increases local level capacity to support state-level strategic directions. Basically, states and locals can be in lockstep with each other and have a much greater base for support. Community transformation grants, which is as I mentioned, is the most recent significant funding stream coming out of the Division of Community Health, reaches 1 in 3 U.S. citizens. And the goal, essentially, as we mentioned, is to create a healthier America by building capacity and implementing these evidence-based and practice-based policy, environmental, programmatic, and infrastructure changes to prevent chronic disease. Supporting the implementation of interventions across 5 broad areas. All CTG grantees are required to work in the first 3 of these 5 what are called strategic directions. The first one is tobacco-free living, which is directly what we're talking about on this call. Active living and healthy eating. This is designed to impact obesity rates across the country by improving the quality of local nutrition and opportunities for safe and attractive outlets for physical activity. And then focusing on heart disease through community clinical and other preventive services. Our grantees also have the opportunity of working in the areas of social and emotional wellness and promoting safe and healthy physical environments. So the tobacco-free living, active living, healthy eating, and community clinical and other preventive services are the ones that are required to work in, and they're required to spend at least 50% of their entire award on those particular areas. Community Transformation Grant Awards, like all of the awards in DCH, are spread across the country. However, because of population requirements to apply, not all communities were eligible the first go-round, which is why the second time out of the gate we had the small community grants. Those were basically eligible to all the other jurisdictions that were not otherwise eligible in the first place. And those are in the those are just wrapping up their second month of activity. Excuse me. Well, the Division of Community Health, as I mentioned, is well founded in the area of tobacco control, and the division and CTG is just part of the picture in that respect. As I mentioned, we also have programs in Communities Putting Prevention to Work, Healthy Communities, and REACH. Under CPPW, communities are funded for tobacco control, and for the most part, they're conducting work in counter-advertising, secondhand smoke and tobacco use restrictions, including clean indoor air, multi-unit housing, and smoke-free outdoor areas, and working in the area of pricing and promotion. Healthy community programs are focused in many of the same areas: secondhand smoke, tobacco use restrictions, cessation, referrals to evidence-based cessation programs, and the regulation of tobacco retail outlets. REACH has historically worked on identification of promising practices in Indian country, for example, identifying culturally appropriate approaches to smoke-free and tobacco-free policy, and enhancing community infrastructure and cessation services. Steve?
Thank you, Paul. So the next slide basically provides a broad overview of some of our key tobacco control efforts in OSH. So as Paul already mentioned, we fund a number of different types of grantees. About 80% of our funding actually goes out the door to fund grantees to do tobacco control work. So the biggest piece of that goes to state programs. So as I mentioned, we have programs that we provide funding and technical assistance and training to in all 50 states and the District of Columbia. We also provide funding to tobacco control programs, as you can see, in 8 territories, some of which have done really exemplary work as well. For example, Puerto Rico has a comprehensive smoke-free law that even makes casinos smoke-free. 7 national networks, so these are groups that work with specific populations, including racial ethnic populations, low socioeconomic status, GLBT, and others that have specific disparities around tobacco use, as I was referring to. earlier, and then 8 tribal support centers that work with American Indian tribal groups in different parts of the country to reduce tobacco use and address tobacco issues. So our focus is on evidence-based comprehensive approaches. As Paul alluded to, we're fortunate in tobacco control that we have a strong science base on what works, and that's thanks to all the efforts of communities and states over the last 20 years to test out approaches and document what worked and what didn't work. And so, we really try and focus our grantees' efforts on doing things that have been shown to work and to have a major impact. We also work with states and communities and other grantees to continue to develop and disseminate new best practices, and I think in emerging areas, and I think this area of smoke-free multi-unit housing is a really good example of that. And we obviously, in addition to working with our grantees, we work with national partners, and that includes both other federal agencies, and I just listed as an example because they're obviously a really important and relatively new partner, the FDA Center for Tobacco Products, but also with non-governmental agencies such as, there are a whole number of examples, but the voluntary, so Heart, Lung, and Cancer Campaign for Tobacco-Free Kids, American Legacy Foundation, and around smoke-free, in particular, Americans for Non-Smokers' Rights is an important partner, as well as the Smoke-Free Environments Law Project, and obviously HUD, the Department of Housing and Urban Development, which I'll say a bit more about later. Next slide.
So this, thanks, Steve. This webinar is to talk about multi-unit housing. So we got rid of all the theoretical and background stuff, and now we're moving on to talk about what we're actually doing in the field. And I know that both the Division of Community Health and the Office on Smoking and Health, as you'll see in later slides, have some success stories to share with you, and we want to start going through those right now. First of all, 80% of all community transformation grant awards that are doing implementation work have some level of effort being placed on multi-unit housing and creating smoke-free and tobacco-free multi-unit housing, which I think is really exciting. It really shows that is one of the real next frontiers for what we're doing, and so we're delighted to be able to be on this call today to talk about how we can match up what's going on in public health departments at state and local level with the other significant players in this game. For the next several years, we've got 27 CTG-funded communities working in multi-unit housing, and I wanted to give a couple of examples of that. In Rochester, New York, the Rochester Housing Authority is looking to establish prohibitive exposure. Is looking to establish prohibitive exposure to smoke-free practices in 1,100 units by the end of December of 2014. So they're taking a unit-based approach. There's some that take building-based approach. There's some that take city-based approaches, so we'll talk some about those too. In Los Angeles County, they're looking to increase the number of cities that implement evidence-based jurisdiction-wide strategies to reduce exposure to secondhand smoke in multi-unit housing and associated outdoor areas from zero. They actually currently have several cities that have smoke-free multi-unit housing, but they're looking to add 12 more to that total at a city level by September of 2016. In the city of Austin, they're looking to increase the number of families living in smoke-free multi-unit housing by 126,000. They're looking to protect another 126,000 families from exposure to tobacco smoke in multi-unit housing settings. And then in Vermont, they're looking to increase the number of smoke-free buildings within multi-unit housing complexes in rural and low SES areas. by another 13,000 by the end of September 2013. So you can see that folks are taking a variety of approaches to how they are addressing the issue of multi-unit housing, and some of these are more sustainable than others. But what I think is important to know is that it's critical that public health departments, especially those that are funded with federal funds, have community partners given the funding restrictions that are placed upon the use of federal funds for work of this nature. As you know, that federal funds cannot be used for lobbying, and there's specific training that we do for all of our grantees on the prohibitions against federal funds for lobbying and what the limits of the use of federal funds are. So we're very clear about that, which is why it's critical that they have a broad array of partners, and those partners know exactly how far federal funds can go, and where the local community partners need to pick up the ball and carry the water to the finish line. Steve?
Thanks, Paul. So just briefly to situate smoke-free multi-unit housing efforts in terms of OSHA's sort of goals and framework. So as I mentioned earlier, one of our 4 goals is eliminating secondhand smoke exposure. And so traditionally states and communities typically have focused on reducing or eliminating exposure in public places and workplaces through smoke-free laws, and which is important because that's a major source of exposure, obviously, for workers, but also for people who patronize those businesses. What we've seen recently is, as now we've got 26 states plus D.C. that have comprehensive smoke-free laws, making private workplaces, restaurants, and bars smoke-free. That as secondhand smoke exposure gets eliminated or reduced in other places, the home is becoming an increasingly important source of exposure. And the home has always been like the major place where children, and especially young children, are exposed to secondhand smoke. But now it's also becoming increasingly important as a source of exposure in many areas for non-smoking adults, because their workplaces have gone smoke-free. In many cases, restaurants and bars in their communities or states have gone smoke-free. So where do you spend most of your time once you eliminate those areas? Well, obviously it's the home. And the other thing we're seeing is that as norms change, and as people live under smoke-free policies and become accustomed to not being exposed to secondhand smoke indoors and other settings, they're more likely to make their home smoke-free, even if they're smokers. So multi-unit housing, though, kind of raises a unique situation in this regard, because if I live in, an apartment or a public housing authority or whatever, I can choose to make my home smoke-free. In other words, never to allow anybody to smoke in my unit. But what we're finding is I can still be exposed to secondhand smoke that infiltrates my unit from a neighboring unit or common area or corridor or whatever, through the ventilation system, through leakages, through walls and ducts and the gaps around fixtures and so on. And so to address and actually surveys that have been done, and my colleague Brian King, who's a researcher in our EPI branch, has done a lot of work in this area. So surveys that have been done show that typically very high percentages, like more than half of non-smoking residents with smoke-free home rules in multi-unit housing report that they actually experience this often on a regular basis, basically having secondhand smoke drift into their unit. And so to address that, over the last few years, there's been more and more interest in policies making multi-unit housing smoke-free. and those can be adopted at a variety of different levels, either voluntarily. So, for example, Jim Bergman's group, the Smoke-Free Environments Law Project, works with apartment and property managers in Michigan, and I think increasingly he works with groups around the country that are doing similar work to implement voluntary smoke-free policies in their apartments. And now, we've started to see that a little bit in condominiums as well. Also, more and more public housing authorities around the country have decided to implement policies. So making, we're talking about making the entire facility, including not just common areas, but all individual units smoke-free. And the Department of Housing and Urban Development has actually issued several notices encouraging, not requiring, but strongly encouraging housing authorities and subsidized housing to consider going smoke-free and to implement smoke-free policies. And then kind of the most recent and emerging area is a number of communities, especially in California, have actually passed laws requiring all or certain types of multi-unit housing, including often both private and public multi-unit housing in their jurisdictions to go smoke-free. And some states also have laws, but they're typically there are no laws that are that comprehensive. Typically, they apply to things such as common areas in multi-unit housing, or establishing that secondhand smoke can be treated as a nuisance in a multi-unit housing situation. Anyway, so the benefits of these types of policies in multi-unit housing, obviously they protect non-smokers from secondhand smoke. And one thing I'll say about that, although the main purpose of the policies is to address this problem of secondhand smoke infiltration, obviously, if an entire apartment or housing authority goes smoke-free, it also has a secondary benefit, which is for those people who are smoking in their own unit, if the policy is, enforced, it also eliminates that. So it eliminates both secondhand smoke infiltration, but also direct secondhand smoke exposure. We also know from experiences with smoke-free home rules in single-family homes that they, in addition to protecting non-smokers, they also help smokers quit. And you would think that the same would be true. And in fact, there's some preliminary evidence from Oregon suggesting that the same is true in multi-unit housing when it goes smoke-free. And then the multi-unit housing smoke-free policies also address disparities, because we know generally, lower income folks are more likely to live in multi-unit housing, especially public, but even private multi-unit housing. Certain racial ethnic populations like African Americans and Hispanics are more likely to live in multi-unit housing. So what's OSH's role in this regard? Well, it's kind of consistent with what we do in most other areas. So we're trying to extend the science base. And again, I'll mention my colleague Brian King, who has published a number of kind of path-breaking studies in this area and continues to do research. We provide technical assistance and training. We work closely with our colleagues in DCH and other divisions here, and with our partners to do this. But and a lot of it is sharing success stories, approaches that have worked in states or communities that we hear from, and giving them a forum to share their experiences with others. And then we work with partners, and obviously in this particular area, HUD is a really crucial partner. Smoke-Free Environments Law Project, as I mentioned, Americans for Non-Smokers' Rights, American Lung Association is doing a lot of work in this area, and many others. And just examples of the types of collaborative work we've done in this area with partners. With ALA and HUD, we hosted a ancillary meeting on this topic at the recent National Conference on Tobacco in Kansas City. We've co-hosted webinars, trainings, and so on. So those are just some examples. And that's it. You can go to the next slide.
All right. Thanks very much, Steve. As Steve laid out, and as I hope was very clear, the Office on Smoking and Health is the authority within CDC on tobacco control issues. And one of the ways, just as OSH has partners across the country with HUD and FDA and so forth, we are one of their partners within CDC, and we try and work in lockstep with what they're doing, with what their data is indicating, and trying to ensure that our communities are working on the same sorts of things that are sustainable through the evidence base that OSH is purporting. I'd like to get into some specific examples of successes that we've seen so far. In Southern Nevada, the Southern Nevada Regional Housing Authority now requires all public housing to be smoke-free, including all properties owned and managed by the Regional Housing Authority, including apartments rented, so including the apartments, and up to 15 feet away from each building and 50 feet from the building entryways. The estimated reach and impact of this is 12,000, almost 13,000 residences are impacted by this particular policy. In Los Angeles, they've also made significant contributions as 7 cities have adopted policies implementing smoke-free multi-unit housing. And in Los Angeles, approximately 40% of all county residents live in multi-unit housing settings. This is impacting approximately 230,000, almost 250,000 residents are being protected from exposure to secondhand smoke. In Boston, the Boston Public Health Commission has provided funding and technical assistance to 5 nonprofit groups, and they're offering 1,700 new units of smoke-free housing, and they're beginning to transition all 64 of their public housing developments to being smoke-free. The reach of this is over 12,000 residences and over 23,000 actual residents. And the last example I wanted to bring up was an example from Seattle, Washington. The Seattle Housing Authority is implementing a policy that will make all 6,000 units owned by the agency smoke-free. This policy covers common areas, all residential apartment units, including low-income public housing units, as well as all units in the Hope 6 communities. It's a special portfolio of buildings and privately managed buildings. The reach of this is over 26,000 low-income households in Seattle. So those are just 4 examples of some specific work that's happened in DCH-funded communities, and OSH has experienced several successes as well. Steve?
Thanks, Paul. So I realized I jumped the gun, so I already mentioned the ancillary meeting that we worked with ALA and HUD to organize at the national conference. So just a couple of other examples. So we again, in partnership, we worked with the CDC Healthy Homes program and really supported them. They were the lead, but in developing a manual on this topic, which kind of walks you through the process of implementing a policy, a smoke-free policy in multi-unit housing. And I should have mentioned too, we worked, we supported HUD in their development of toolkits. They've earlier this year put out 2 toolkits on this topic. One for managers or like owners of housing, and the other for renters or tenants, with a lot of really useful resources. And then, as I mentioned, we held a webinar, conducted trainings, and we're currently working, again, Brian King is the lead on these. So trying to do sort of at least a top-line estimate of how big a problem is this really? In other words, how many people actually live in multi-unit housing and are being exposed, and specifically how many non-smokers are being exposed in that setting, both nationally and by state. So that's one study that is in the works, and then we're also trying to take an initial look at the cost savings that are associated with going smoke-free in multi-unit housing. And then, of course, our project officers work closely with state tobacco control programs that are doing work in like all of the areas that I mentioned earlier, including smoke-free and including smoke-free multi-unit housing. So there's a lot going on. I don't want to get in details, and it's a little bit harder to enumerate, I think, than it is for DCH, because we're working at the state level, and typically, at least in most states, much of this activity is still going on at the local level, and we're kind of one step removed from that, even though obviously the state programs that we fund are very involved in doing local work. Next slide.
Thanks, Steve. Well, one of the things that just like Steve and I work together on multi-unit housing issues within CDC, as well as other issues around tobacco control, communities and states CTG awards, as well as OSH-funded state agencies, can be valuable partners and critical stakeholders in statewide multi-unit housing efforts, and in fact any effort dealing with tobacco control. But specifically with multi-unit housing, I think there's a capacity also within communities to design and implement pilot projects that align with state-level priorities, certainly, but focus on multi-unit housing. As you've clearly seen, that the issue of multi-unit housing is an important issue for CDC regarding exposure to secondhand smoke and exposure to other tobacco products. So that's definitely a ripe opportunity for you guys to get involved with communities as well as states that are working in this area. And it's something that I would encourage some proactive communication, as well as our efforts to promote that our funded agencies expand their partner base at the local level to reach out to all appropriate partners in this effort to, first of all, assess the current environment and then to identify opportunities to move forward. Our implementation awards may be conducting work, and as I mentioned, 80% of all of our implementation awards are conducting work that is in the area of multi-unit housing, and that work may in fact align with OSH-funded state-level efforts. And then community grantees can also help to build the evidence base and identify and disseminate best practices. So, I mentioned 80% of all the communities. So what exactly are those communities? Well, as you can see in this list, they're all over the country. Wisconsin, Florida, Texas, California, Colorado, all across the Midwest, including Oklahoma City in the east, North Carolina, Massachusetts, Vermont, New York. So they're really all over the country. What I would encourage you to do, this list of this presentation, including this list, is going to be going out to you after the end of the presentation. So feel free to go on the OSH website or the DCH website and take a look to see who exactly in these areas is funded for community transformation grants, for example, and see if there's the opportunity to partner in these efforts. One of the things that was stated as an objective out front was funding opportunities in this area. CDC and, well, specifically Division of Community Health and the Office on Smoking and Health do provide funding on a regular basis, but unfortunately, occasionally our recipient potential recipient list is rather limited. As Steve said, OSH funds state, and it's a congressional requirement that they fund the state programs as well as the other sectors with the networks and the national partners and so forth. Community transformation grants are a little more flexible. We just recently, let's see, about a year and a half ago, we funded a set of 62 grantees, large community grantees, and this most recent round of 40 grantees was for small communities, and communities actually were eligible for additional points in their application if they were not an agency whose specific mission was public health. So we definitely have opportunities available. Unfortunately, without knowledge of what Congress is going to give us from the Public Health Prevention Fund, we're not sure what funding we're going to have available in the future. What we do know is that we have funding for communities anyway. There's CTG funding in over 100 communities across the country, and we would encourage you, if you're interested in taking up the mantle of smoke-free multi-unit housing, to contact them and see what it is you can do to help partner with them in furthering their efforts if they're on this list. Additionally, in addition to the communities, we're also furthering this work by funding several national networks. The networks are funded for work across the country, and in particular to help reach rural and frontier areas who are experiencing unusually high levels of health disparities. Multi-unit housing is a key element of the work that's being spearheaded by the American Lung Association, the National REACH Coalition, the YMCA of the USA, HUD, Americans for Non-Smokers' Rights, which Steve mentioned earlier, Smoke-Free Environments Law Project, and the Environmental Protection Agency Indoor Environments Division. The ALA is specifically funding projects in Phoenix, New York City, and Milwaukee. There are some additional collaborations that I wanted to mention to you. CDC has funded a project that's being conducted in LA County and 3 other communities across the country to assess the health benefits of multi-unit housing interventions and to study the implementation of smoke-free policies in market-based and subsidized multi-unit housing complexes, with the goal of understanding how best to implement smoke-free policies that will protect residents from the adverse health effects of secondhand smoke. The specific aims of this research are to examine the health impacts, as I mentioned earlier, examine the cost-effectiveness of smoke-free policies, and to examine barriers and facilitators to implement smoke-free policies in reducing health exposure or SHS exposure in multi-unit housing complexes. At this point in time, I'd like to, on behalf of Steve and I, say thank you for listening and for participating in this call, and open the lines up to any questions you might have of either Steve or I.
Hi, actually, thank you, Mr. Hunting, and thank you, Mr. Babb, for providing such wonderful information to our grantees. And Mr. Babb, you mentioned the smoke-free housing toolkit, and we actually have Lindsay Vick here, who is the Director of North American Management's Housing and Community Revitalization Project, and she will talk a little bit more about those toolkits and any other ways to partner with public housing agencies.
Thank you, Johnette. Hi, everyone. The housing group here at North American Management works with federal agencies, state and local agencies, and public housing authorities to improve the delivery of public and assisted housing programs across the nation. As Johnette mentioned, under a recent contract with HUD and in partnership with HUD's Office of Healthy Homes and Lead Hazard Control, the ALA, the American Academy of Pediatrics, and CDC, we developed 2 different smoke-free housing toolkits. One was developed for use by residents, and the other was developed for use by owners or management agents. With guidance from a national advisory board, we assembled best practices, sample transition and policy materials, education materials, and organizing tools for resident and management. We also develop tools for managers to use as they go through the transition process. The toolkits are designed to be easily understood and utilized by both residents and management. We release them for publication over the summer with mailings to about 3,000 housing authorities or multifamily housing organizations and more than 400 resident groups this fall. If you'd like to download a copy, you can go to HUD's website and click on the link for the Office of Healthy Homes and Lead Hazard Control, and you can download a PDF. Health centers that are interested in partnering with housing authorities should contact their local agency and offer to assist in the implementation process by providing cessation information and support. Housing authorities can contact their local or state health agency, community health centers, local hospitals, as well as funding sources for cessation support to get resources for their residents as they move through this process. Now, I want to note that the toolkit's objective is not cessation itself, but relocation of smokers to outdoor environments. The relocation preserves the health of the residents who live in those units, as well as reducing the overall cost to the housing authority of maintaining those units. Some housing authorities have also enjoyed a reduction in insurance premiums because they have a reduced fire risk. There have been a number of organizations mentioned on this call where you can get more info on cessation support, but I want to add a couple, and I may repeat some that have already been mentioned. So the EPA, Campus Fire Watch, the Smoke-Free Environmental Law Project, the Home Safety Council, Smoke-Free Housing New England, and the National Center for Healthy Housing. And that's all the information that I have to provide today. Happy to take any questions or field emails or calls from you at a later time as well. Thanks so much.
Great. Thank you so much, Lindsay. So we now will move to the question and answer portion of the webinar. If you would like to ask the presenter a question, please submit it through the questions box on your control panel. Or if you are dialed in through your telephone and would like to verbally ask the presenter a question, use the raise hand icon on your control panel and your line will be unmuted. As of now, we do not see any questions, so we're just going to wait a few minutes to see if any questions come in.
There is one question. It is, what was the website where we can download the smoke-free housing kit?
Sure, that's HUD's website, and that is www.hud.gov. And once you are on that site, you'll look for the Office of Healthy Homes and Lead Hazard Control, and they have a link to download the toolkits there.
Okay, another question has come through. Is there any data on third-hand smoke in public housing?
Steve, I think you might be the best one to answer this, and this might be something that we need to get back to. But just to explain for folks that may not know what third-hand smoke is, it's kind of a new term, and so thanks for bringing it up. Secondhand smoke, as you know, contains, or may know, contains many thousand of different kinds of particles, including well over 50 carcinogens, and which is why we're concerned about secondhand smoke in the first place. But those particles are heavier than air, so when there's smoke that occurs in an enclosed space, those particulates settle into things like carpet and furniture and cushions and so forth. And when somebody walks across carpet or walks across or sits on a cushion, those particles are re-released up into the air, even though no active smoking is going on. So that's kind of a definition of third-hand smoke. But Steve, do you have any data on exposure?
So, and thanks, Paul. That's helpful. And I think, you know, one I mean, third-hand smoke is kind of a catchy term, and it's useful because it calls attention to an important, problem that had been sort of overlooked previously. I think, one potential downside is it can sort of mean a number of different things. And to me, when you're talking about multi-unit housing, the biggest issue is probably, it's called by different terms also, but transfer or infiltration or leakage of secondhand smoke. So, I mean, in like real simple-minded terms, when I think of third-hand smoke, I think of its exposure to secondhand smoke that occurs after someone is no longer smoking. So the cigarette's out, but the constituents of secondhand smoke, as Paul said, linger and they settle on surfaces, and there's some evidence that they can actually react with, for example, nicotine can react with other common substances on surfaces to form carcinogens and create even additional problems. To me, in multi-unit housing, probably the more immediate and larger problem is, however you want to call it, but it's basically secondhand smoke exposure from smoking that is going on currently, but not in your unit, but in someone else's unit, but it's drifting into your unit. And to me, I guess you could call that third-hand smoke, but I mean, to me, it really is just another variant of kind of plain old secondhand smoke. And there is some evidence on this. It's an area of increasing study. So, for example, and I don't mean to keep harping on his name, and he's really not paying me anything for this, but Brian King, when he was at Roswell Park Cancer Institute before he came to OSH, did a study which is, I think one of the good sort of initial studies on this called secondhand smoke transfer in multi-unit housing, and it basically just documents that transfer does occur from both units where people are smoking and adjacent hallways into the individual units of people who don't smoke in their unit. It's a little bit harder to quantify it than more traditional secondhand smoke exposure, but there's clear evidence that it does happen. And so when you get these large numbers of non-smokers who live in multi-unit housing saying that they're experiencing it, they're not lying. The evidence from measuring, for example, particulate matter or nicotine in the air documents that it is happening. And in Brian's study, he showed that when you saw someone smoking a cigarette, for example, in one unit, you would then see spikes in particulate matter in an adjoining unit with directly linked to that in terms of when they occurred. So I think, the simplest thing I can say is, I don't think there is any question now anymore that people are being exposed in this way. The exact, the amount of the exposure, I think, is still being nailed down, but then we also know that, the Surgeon General is on record as saying there's no safe level of exposure to secondhand smoke. So let me stop there, and does that answer the question?
Yes, thank you very much.
And
we have another question.
John, may I just add real quick? There's a study that was published in 2004 from the Center for Energy and Environment that states research demonstrates that up to 65% of air can be exchanged between units, and that smoke travels through tiny cracks, crevices, and spacing, which involuntarily exposes individuals in adjacent units. So some additional data that's on that from that study.
Great, thank you.
Thank you, Mr. Babb, and thank you, Lindsay. We have another question where someone would like to locate resources to implement multi-unit housing smoke-free policies in San Jose, California.
Great, go for it. Okay, so looking for resources. The first place, and Steve may have other information on this as well, as I know the multi-unit housing toolkit is also a great resource. But what you might do is you might contact the Santa Clara County Health Department in San Jose. They were a CPVW recipient, and I believe they were working on smoke-free multi-unit housing, so that might be a good place to start. If you'd like to know exactly who the contacts are for that, those are available on the CDC's Division of Community Health website.
And this is Steve, and I just put a plug in too for, so as was already mentioned, the HUD toolkits are a great resource on this. And then I can give the link to, so the Healthy Homes Manual that I mentioned earlier that our colleagues in the Healthy Homes program here at CDC put out a year or two ago. You can access that at www.cdc.gov, and then it's /healthy homes, and that's all one word, and /healthy _home _manual _web.pdf, or you can do what I just did and just Google CDC Healthy Homes Manual, and you should be able to get it. That's a great resource. In addition, as I mentioned earlier, the Smoke-Free Environments Law Project has a lot of good resources in this area. I mean, this isn't all they do, but they do a good job of this. Let me just pull up their, bear with me a second, just pulling up their website. So, and this is, it's a short website. It's a little bit, they're part of a larger organization, so it may be a little bit confusing, but you can find them at www.t as in Thomas, C as in cat, S as in Sam, G as in golly, I guess, .org. So www.tcsg.org, and then /SFELP for Smoke-Free Environments Law Project, and /home. But I think if you even just bring up, or again, if you just go Google, again, it's the Smoke-Free Environments Law Project, and once you go there, you'll see that they prominently feature a lot of information on smoke-free multi-unit housing. And then the last thing just to mention, our website at OSH is just www.cdc.gov/tobacco. And if you go there, you'll find information on secondhand smoke. We have less probably information directly on multi-unit housing, but certainly good resources on secondhand smoke and smoke-free policies in general. Again, www.cdc.gov/tobacco.
With regard to the smoke-free housing toolkit, the owner's toolkit contains a landlord's guide, which is a step-by-step process towards going smoke-free. An FAQ, things that you need to know about as you are learning about the process and beginning the process. And additional other tools like a sample resident survey, possible house rules and changes to those rules, as well as some legal information.
Great. Thank you guys for providing so much information. We have one last question. Are residents of smoke-free housing experiencing notable changes from previous housing arrangements?
Steve, do you want to address that?
So, in terms of, so I'm assuming that's talking about so sort of changes in exposure or health outcomes. So, because this is a relatively recent phenomenon, this whole kind of, I guess, smoke-free movement within multi-unit housing, we don't have as much information on that as we do. Like there's a large body of research showing the benefits that occur when workplaces and public places go smoke-free. However, there was a study out of Oregon recently, and I could actually forward this if you had a way to forward it to people. But so this was a study of subsidized multi-unit housing in Oregon. So it was, I'm just looking at the study, it was, they studied 839 tenants in 17 subsidized buildings shortly, like several months after they went smoke-free. And what they found was, so several outcomes. So people who self-reported that they were smoking indoors decreased from 59% to 17%, so that's a pretty substantial decrease. Among non-smokers, you know, the proportion who were saying that they were frequently exposed to secondhand smoke indoors also decreased substantially from about 40% to about 17%. And about half of smokers reported that they were smoking less, you know, they were smoking fewer cigarettes. And finally, they found an increase in the quit rate. So they were looking at an annualized quit rate among the population, the smokers in the population, and that increased from about 3% to about 15%. So again, I mean, it's one study, you know, it's in one state, but you know, those are pretty impressive outcomes, and it's you know, certainly suggestive that you could see some of the same benefits that we've seen from smoke-free policies, you know, as I mentioned, in workplaces and public places. You know, obviously there's a need for more research in this area, and I'm sure we'll start seeing similar studies as you know, more and more multi-unit housing goes smoke-free.
And if I could follow up on that, on one of the slides in the presentation talking about the additional research that's going on in LA and 3 other communities across the country, one of the specific aims of that is to examine the health impact of smoke-free policies and reducing exposure through an analysis of environmental and biometric data. So that's a fairly substantial portion of that follow-up study. I think the thing that's also important to mention is something that Steve said, in that, remember, the Surgeon General has stated that there is no safe level of exposure. So anything that we can do to reduce that exposure, especially to some of the most vulnerable populations who happen to live in multi-unit housing, the better. Thank you.
Great, thank you. We did just receive one last comment requesting that all email links are sent to attendees, and we will be sure to do that. Thank you once again, Mr. Hunting and Mr. Babb, for providing so much information to us on the CDC. And Lindsay, thank you for providing additional information on the HUD toolkits. And we'd like to thank all of our attendees once again. We do apologize for the delay and for going slightly over the time, but we hope that you guys learned a lot. And if you have any questions or comments, you can always email the staff here at North American Management.
Thank you, everybody.
Thanks for hosting
Thank you.
this, and thanks everybody for being on the call.
Thank you.
Bye.
Bye.